From statistics, we know that acne happens more commonly among the teenagers from age 13 to 18. But adults can have acne as well. And some of the teenagers who have acne will continue to have acne when they are adults. There are two types of acne basically. One we call it inflammatory and the other we call it non-inflammatory acne. Example of inflammatory acne are your bumps, the pus-filled cavities. Whereas the non-inflammatory ones are your pores, the black pores, white pores, which we call comedones. This is the top layer of the skin, and this is the middle layer, and this is the fat layer of the skin. We have a hair follicle here, and this is the oil gland, or I call it oil factory. In a normal patient, skin will be desquamated, will be shed off periodically from here to here. And the oil factory will produce oil that will be secreted through the hair follicles to the top of the layer of the skin to moisturize the skin. But in patients with acne, this process of shedding off the dead skin is impaired, and therefore the hair follicles is blocked. And secondly, the oil factory is very active and it produces a lot of oil. So when the oil is unable to be excreted out, it will become blocked and it will get bigger and bigger, and eventually it will rupture, causing inflammation, pus. Besides that, there is also an increase in the number of bacteria we call P. acne in the skin. Wash your face regularly at least 2 times a day with a gentle cleanser. Avoid using scrubs and avoid popping pimples, squeezing your pimples. And avoid products that can block pores. So if you were to go to the counter to buy products, make sure look for the products that says non-comedogenic. Comedones just means pores. So anything that is non-comedogenic shouldn't block your pores. Why can't we squeeze out pimples? First of all, your hands may not be clean when you do that. And secondly, there's no exit point that you create. So instead of popping out the pimples, you may push the pimples deeper in, causing more damage, more inflammation, and ended up scarring. So we do comedone extraction. How we do it, first we have to create an exit point, and later only we squeeze it with a comedone extractor, so that whatever the content, the sebum or the oil, can be squeezed out. Do we treat or diagnose acne? First of all, we have to make sure that the diagnosis of acne is correct, because a rash on the face doesn't equal to acne. There are other causes of a rash on the face. For example, eczema, rosacea can also cause a rash on the face. And once we establish the diagnosis of acne, we have to rule out the secondary cause of acne. For instance, hormonal diseases like polycystic ovarian syndrome in ladies, among the ladies, where they have multiple cysts in the ovaries. Then we also have to rule out thyroid diseases that can cause acne. Medications such as steroid and also antituberculosis can also cause acne. And finally, the environment. I have patients who are chefs working in an oily environment can present with acne because the oil will block the pores. And also products. As I mentioned earlier, find products which are non-comedogenic, because if the product is comedogenic, it blocks the pores, again it causes acne. Once we have established the diagnosis of acne and rule out secondary causes, we can then initiate treatment. Treatment includes topical creams, oral therapy, and also adjuvant therapy. Adjuvant therapy is, for example, chemical peels, comedone extraction, light therapy, and also laser therapy. Ask me, how do we treat acne scars? I'll tell them, first of all, get your acne well controlled first. No point treating the scars when the acne is not well controlled, because acne will lead to scar again. If it's not well controlled, you have more scars. So once the acne is controlled, we will treat the scars using lasers. Lasers is the only one with the most evidence to treat acne scars. Example of lasers used will be fractional lasers, either fractional carbon dioxide or fractional radiofrequency lasers. Laser energy penetrates tissue, leaving small micro wounds breached by healthy tissue. Patient's natural healing process stimulates the creation of new tissue and collagen that will reduce acne scars. Acne is an easily treatable disease. Seek treatment early, because it's easier to treat acne than to treat the scars.